2025 Prometric provides foot care on one foot. Knock on the door. Greet and address the resident by name and title. Introduce yourself by name and title and explain the procedure. Ensure the bedwells are locked and that the bed is in a low safe position. Give the call light to the resident. Provide privacy by closing the privacy curtain. Ask the resident about their preferences, then verbalize washing hands. Gather a clean barrier to place on the floor in front of the resident's feet. You may use a towel or a chucks pad. You may gather an additional clean barrier to place on the floor if you kneel while cleaning the foot. Gather remaining supply items. You will gather a total of 8 items: a bath basin, soap, lotion, 1 pair of gloves, 2 washcloths, and a towel. Organize these items on the clean barrier on the floor. It's best to arrange them in the order in which you will use them. This will prompt you as to what step comes next. Fill the basin with moderate temperature water. You must test the water before allowing the resident to test the water. You may test it at the sink while filling the basin or when you return to the bedside. Once you return to the bedside, allow the resident to test the temperature of the water. If the resident is wearing socks and shoes, remove the sock and shoe from the resident's foot. Support the foot behind the ankle joint and place it into the barrier. Verbalize that you will soak the foot for at least 5 minutes. Don clean gloves. Wet your first washcloth, squeeze it out, completely open it, and apply a generous amount of soap to all areas of the washcloth. Rub the washcloth together to produce a lather. Once you lift the foot from the basin, you cannot place it back into the basin. Remember to always support the limb behind the joint. Wash all areas of the foot, including between the toes. Place the used washcloth on the side of the basin or on the clean barrier, away from the clean supplies. Wet your second washcloth and rinse the resident's foot. Remember to rinse between the toes as well. Place the second washcloth on the side of the basin or on the clean barrier, away from the clean supplies. Dry the resident's foot. Dry between the toes. Apply lotion to gloved hands. Rub your hands together to warm the lotion. Then apply the lotion on the top and bottom of the foot. Do not apply lotion between the resident's toes. Remove any excess lotion from the foot by patting it dry with the towel. Put on the resident's sock. Remember, when lifting the foot, always support behind the ankle joint. Put on the resident's shoe. If you roll the resident's pants leg up, now roll them down. Dispose of your soiled linen into the soiled linen hamper, ensuring it does not come in contact with your clothing. Empty the basin into the sink. Rinse the basin and empty the rinse into the sink. Dry the basin. Ensure that the basin is completely dry. Replace the basin, the soap, and the lotion back in storage. Remove your clean barriers and appropriately dispose of them. If you used a chucks pad, dispose of the chucks pad into the waste bin. If you used a towel, dispose of the towel into the soiled linen hamper. Remove gloves without contaminating yourself. Immediately dispose of them into the waste bin, then immediately verbalize washing hands. Ensure that the bed is in a low safe position and the bed wheels are locked. Ensure that the call light is within the resident's reach. Ask the resident if they want their privacy curtain to remain closed or open. Ask the resident about their preferences, then verbalize washing hands, skill complete.